My name is Eric Van Zytveld, and I'm a general dentist in Denver, Colorado. During my early career, I spent about a quarter of my time treating geriatric and special needs patients. With varying degrees of success and failure, I used different kinds of material to splint periodontally involved teeth. For the past 3 years, I have been using Dentapreg splinting materials for several applications. I have had excellent results using it to stabilize periodontally involved teeth. I use Dentapreg to fabricate anterior bridges for both short and long-term applications. And I have found Dentapreg very useful for reinforcing large restorations. Lastly, I use splinting materials to reinforce crown and bridge temporaries, for denture repairs, and to strengthen occlusal guards. This presentation will cover my technique for fabricating a direct anterior bridge with Dentapreg. There are numerous situations when a Dentapreg anterior bridge works well. I use anterior bridges primarily during the healing period for implants, and as semi-permanent bridges for patients of all ages. Of all the materials I've tried, Dentapreg is the easiest to apply and manipulate. The bridges can be made conservatively, with little or no removal of tooth structure. My bridges have held up well and can be very aesthetic. Anterior bridges can be fabricated with Dentapreg directly in the mouth or semi-directly on a model. When I would like to have more control over aesthetics, I prefer to use the semi-direct technique, but I've had excellent results with the direct technique, such as in emergency situations when I do not have a model. I have found anterior bridges are particularly useful for patients like David. Due to financial and emotional problems, he had neglected his teeth for years. He had rampant caries, and his self-esteem was very low due to tooth number 9 being broken off at the gum line. I performed caries control and worked with him on improving his hygiene. Since David could not afford a permanent replacement, I decided to fabricate a semi-permanent Dentapreg bridge using the direct technique for him. I began treatment by placing a rubber dam to ensure a dry working field. Then I thoroughly cleaned the teeth and prepared the abutment teeth. I created rest preps to help support the bridge. If I plan on replacing the bridge with a more permanent solution, I usually do not prepare rest preps. Normally, I isolate the interproximal spaces with either wedgets or wedges. In David's case, the spaces were too tight for me to get wedgets between the teeth. There are numerous ways to measure the length of Dentapreg required. You can use a piece of floss or a perio probe, but I use wedgets the most often. I use this as a guide to cut the required length of material. Dentapreg recommends the PFM material for anterior bridges. The strip is packaged with a foil backing, which you peel off. It is recommended that you handle the strip with gloves and cotton forceps. Scissors can be used to cut the strip at the desired length. Leftover material can be replaced in a special package for later use. The next step is to apply etching gel to the teeth to be bonded. Rinse off the gel thoroughly and dry the teeth. Apply the bonding adhesive. Light cure the adhesive. I apply a thin layer of flowable composite to the teeth where I want the strip to adhere. I find the Dentapreg fork and shield very useful in manipulating the strips. I use cotton forceps to place the strip and either a packing instrument or the fork in the shield to adapt it. I found it is easier to work with the strips if the end is not frayed. You can mold it back together and use flowable to help adapt the strip. I place the strip with the uncured flowable towards the tooth surface. The shield can be used to block light so that the strip can be adapted and cured in segments. Once the strip is bonded to the abutment teeth, I use composite to build the Pontic up in layers. I finish building the Pontic up and polish the composite. I adjust the occlusion to limit excursive contacts on the Pontic. This is David's final bridge. David's hygiene and self-esteem have improved markedly since his front tooth has been replaced. Occasionally, I have used the patient's natural tooth as the Pontic by cutting a channel across the lingual for the strip to fit in. Sometimes I use a denture tooth as the Pontic. In this case, I converted a flipper into a direct anterior bridge. I made a putty matrix in the patient's mouth before I cut the denture tooth off of her flipper. This made cementation in the mouth much easier, resulting in this final result. This is Bob. We are keeping the root for number 8 while the patient saves to have an implant placed. I began with a denture tooth and modified it using composite. Using the semi-direct technique, I fabricated a bridge with Dentapreg's PFM strip. This case brings up the importance of looking at the patient's occlusion. You need to make sure there is adequate space for the bridge work. I've had better results when I have adjusted the occlusion to limit fremitus on the abutment teeth and excursive contacts on the Pontic. In my practice, direct and semi-direct Dentapreg anterior bridges have proven to be cost-effective, conservative, aesthetic, and very reliable. I hope this presentation has increased your understanding. Thank you very much for your time.